The presentation of the calf refers to the longitudinal axis of the calf to that of the dam. It can be either anterior or cranial, posterior or caudal, or transverse. It's usually pretty obvious to determine if it's a cranial or anterior presentation because the head is present. However, you may have a lateral neck flexion and only have two legs presented in the birth canal. In this case, you need to determine are there front legs or back legs. A clue here is if it's a cranial presentation with a dorsosacral position, then the soles of the feet will normally face down. Another indication that it's a forelimb is that the fetlock and the carpus bend the same way, whereas with the hind limb, the fetlock and the tarsus bend in the opposite direction. With a caudal or posterior presentation, with the dorsosacral position, the soles of the hind legs will also face upwards. Position refers to the dorsum of the calf in relation to the pelvis of the dam, so this would be dorsosacral. The calf could also be dorsoileal or dorsopubic. You can see here that although there are forelimbs, the soles of the feet are actually pointing upwards. So to determine if it's a forelimb, you need to check if the fetlock and the carpus bend the same way. The final component of the disposition is posture, which refers to the fetal extremities. In this case, we have a unilateral left shoulder flexion. This would be a left lateral neck flexion. This would be bilateral coxofemoral or hip flexion, where all you feel is the tail and bum of the fetus. This is known colloquially as the breech position. This would be a bilateral tarsal flexion. And this would be a unilateral tarsal flexion. Again, note it's a hind leg because the soles of the feet are facing upwards and the fetlock and the tarsus bend in opposite directions. Everything in obstetrics relies on loops. This is one way to make a loop, but then you have a large knot that could cause quite a lot of damage to the vagina when you're busy pulling the calf out. So let me show you an alternative way of doing that rather. With these type of nylon ropes, use a pen down the center of the rope to open it up. You can then tuck the free end of the rope through the cavity that you've just made. This is like a Chinese finger trap and forms a very strong loop that will be sufficient for your carving. Make sure the free end is tucked down as far as it can be to prevent slipping. Then you need to make a noose, like so. And then you want to apply this noose above the fetlock. Okay, now supinate your hand to make a loop and then shake the claw of the calf to form a half hitch and a second loop below the fetlock. Okay, so supinate your hand to form a half hitch. Put your hand through the loop and shake the claw of the calf and slip that loop over your hand to just below the fetlock. This distributes the tension on the rope above and below the fetlock. Next, you need to apply the rope handles. So again, supinate your hand and then pull the end of the rope up through that loop and slip the rope handles through that noose. Carving chains can be applied the same way. Please note the curve of this first link of the chains and make sure that it's quite flush with the leg of the calf. Make a loop and apply this above the fetlock of the calf. Then similarly, supinate your hand, shake the calf's paw, slip the noose over your hand below the fetlock, and again distributes the weight evenly above and below the fetlock. These are chain handles. Please note the difference between chain handles and eye hooks, and don't confuse them. The chain handles can be applied anywhere along the length of the chain. They don't only have to be applied at the end. This is a head snare. The head snare should be put in your hand like so, and put behind the calf's ears, and then in the mouth of the calf above the tongue. You need 3 points of contact, so the head, 2 legs. If you don't have control of the head, then every time you pull the legs, the head will concertina backwards and make it very difficult to pull the calf out. Do not use the head snare to pull the calf out of the cow. It's simply to control the head. You, as the vet, need to be in control of that head snare at all times. If you do not have a pre-formed head snare, you can make a war bridle using a rope. Again, make a noose and then apply that behind the ears and in the mouth of the calf. The same principles that apply to the head snare apply to the war bridle. So don't use it to pull the calf out of the cow, it's simply to control the head. You can use eye hooks instead of a head snare. Please make note of which ones to use. In live calves, you want to use the blunt eye hooks, not the sharp ones. The eye hooks must be threaded facing each other. If they are facing in opposite directions, once you put one in, as soon as you go to put the next one in, the first one will fall out, which can be very frustrating. Eye hooks push the eyeball backwards and hook over the orbit of the eye. They're not supposed to cause any damage to the eyes. Again, similar to the head snare, they are just to control the head. Do not pull the calf out with the eye hooks. Remember that a cow's pelvis is largest on its diagonal, not the vertical horizontal axis. Therefore, we want to try and get the calf a little bit on its side in order to get it out properly. In order to prevent the shoulders getting stuck, you need to use alternate traction to extract the calf. So you need to pull one leg and then the other leg and basically walk the calf out of the cow. The next area to get stuck would be the hips. In order to prevent this, get the people pulling the legs to switch over. If they keep pulling, they're going to actually tilt the calf into a dorsoiliac position, which, if you remember, is the greatest diameter of the pelvis. If you have a malposture, always put a rope on the limb that you can access. Then apply lube. You can never have too much lube. You will then need to retropulse the calf. There's no space in the pelvic canal to manipulate the calf. Once you've pushed the calf back into the abdomen, you can then try and resolve the malposture. This is termed mutation. Once you've applied lube and retropulsed the calf, you can then attempt to correct the malposture. Basically, the carpus needs to be twisted craniolaterally and the distal portion of the limb needs to be twisted medially in order to try and extend it. If you can get 2 hands in, then one hand can be used to lift the carpus and the other hand can be used to twist the distal portion medially. There often isn't room to get 2 hands into the vagina of the cow, so you can use a rope in place of one of your arms. Apply the rope to the carpus and try and twist that craniolaterally whilst using your arm to twist the distal portion of the limb medially. Always remember to cup the claws of the calf to prevent damage to the vulva. Lateral neck flexions are one of the most difficult malpostures to resolve. Your arms are simply never long enough. Remember to apply sufficient lube and to retropulse the calf so that you have the calf in the abdomen in order to have space to move. You can then try and apply a head snare or a wall bridle and retropulse the thorax of the calf whilst trying to get the head round. You can also try eye hooks instead, but if you're not coming right and the calf is alive, I really would recommend doing a cesarean sooner rather than later. Remember before you do any mutation that you need to lubricate the calf and then retropulse it into the abdominal cavity before you can do any manipulation. After applying lube and retropulsing the calf, we can try and resolve it into a tarsal flexion first. Then try and twist the tarsus craniolaterally and the distal portion of the limb medially. You may be able to get 2 hands in there. Always remember to cup the claws so that they don't scratch the vagina as you extend the limb. If you can't get 2 arms in there, you can always use a rope in place of one of your arms. Once you've corrected the malposture and have the calf in the correct disposition, 2 strong men pulling for 10 minutes should be enough to get that calf out. You should also be making progress continuously. If you're not making progress, please consider doing a cesarean if the calf is alive. You're going to get pretty tired very quickly, and you still need to do the cesarean if the calf is alive. If the calf is dead, you can consider doing a phytotomy. Always do a vaginal exam postpartum. Check for another fetus. Check if there are any tears in the vagina or in the uterus. Make sure that the cow can stand up postpartum. In terms of treatment, consider using antibiotics and anti-inflammatories, especially if the obstetric intervention was protracted. Also consider giving oxytocin if the calf was dead to ensure expulsion of the fetal membranes.